Interpret the data and give the type of acid-base disturbance. pH 7.54, bicarbonate level 26 milliequivalent per liter. What is the probable diagnosis? Explain. So let's see what it is. So you have increased pH, which indicates the alkalosis. This is a case of respiratory alkalosis. What exactly is this respiratory alkalosis? It is primarily due to carbon dioxide deficit, that is carbonic acid deficit due to hyperventilation. It's a medical condition in which increased respiration elevates the blood pH beyond the normal range with a concurrent reduction in arterial levels of carbon dioxide. So increased breathing produces increased alveolar respiration, expelling the carbon dioxide from the circulation. This alters the dynamic chemical equilibrium of carbon dioxide in the circulatory system. So what are the causes of respiratory alkalosis? So here in this case, in the lab data what is given, we can see there's increase in pH, okay, and then PCO2 decreased, the primary abnormality what is seen in a case of respiratory alkalosis. Coming to the causes for respiratory alkalosis are mainly the febrile conditions, septicemia, pulmonary emboli, brain tumors, meningitis, high altitude, then even in case of hysterical hyperventilation, the respiratory alkalosis can be seen. This hysterical hyperventilation mainly seen in hysteric females. They end up with the respiratory alkalosis. So early stages of salicylate poisoning causes respiratory alkalosis due to stimulation of respiratory center, but it later ends up with metabolic acidosis due to accumulation of the organic acids and the organic acids. So that is what was the first case, that is high anion gap metabolic acidosis. So coming to the investigations. Before investigations, let's know how the case presents with. Here it is hyperventilation which occurs on stimulation of respiration as in fever. There is shortness of breath, muscle cramps, tingling and paresthesia. Anxiety, palpitation, sweating, convulsions and tetany can be seen in a case of respiratory alkalosis. Coming to the investigations, the main investigation being the arterial blood gas analysis along with other parameters like blood sugar level, creatinine, serum electrolytes, chest x-ray and the pulmonary function test. What are the compensatory mechanisms which come into action in this case? So increased renal excretion of bicarbonate ions to eliminate the bicarbonate ions and to bring the pH to normalcy. Reduction in urinary titrable acidity and ammonium ions to conserve hydrogen ions to decrease pH. So what is the treatment modality here? Mainly treat the underlying cause. Again, this respiratory alkalosis is very rarely life-threatening condition, though pH level should not be more than 7.5. The aim in treatment is to detect the underlying cause and treat the cause. If the individual is on a mechanical ventilator, then preventing hyperventilation is done via monitoring the ABG levels. So this completes the case of respiratory alkalosis. So in acid-base disorders, we have dealt with the metabolic acidosis, alkalosis, respiratory acidosis and alkalosis. We have to know the basic changes which occur in the pH, bicarbonate level, what happens to the ratio of bicarbonate and the carbonic acid, and also the PCO2 levels and the causes and the different types. That is all is to be known under these cases. Thank you. Have a nice day.